So what is eating disorder in a simple words? Eating disorder are serious health conditions that affect both your physical and mental health. These conditions include problems in how you think about food, eating, weight, and shape, and in your eating behaviors. Okay, so now, what are the factors affecting eating habits in adolescents? These factors including the quest for independence and acceptance by peers, increased mobility, greater spend at school or work activities, and preoccupation with self-image contribute to the erratic and unhealthy eating behaviors that are common during adolescence. So what is one of the most common eating disorder in adolescents? The most common eating disorder among adolescents are anorexia nervosa, bulimia nervosa, and binge eating disorder.
Anorexia nervosa, an eating disorder characterized by an abnormal low body weight, an intense fear of gaining weight, and a distorted perception of weight. Anorexia nervosa is diagnosed when someone restricts food intake. This problem is more common among girls and women than boys and men. Bulimia nervosa is an eating disorder that causes you to eat large amounts of food at one time and then get rid of it. The main signs of bulimia are eating a large amount of food over a very short time and then ridding your body of the extra food by making yourself vomit, taking laxatives or diuretics, fasting or exercising excessively. The typical profile of a person with bulimia nervosa is an adolescent to young adult female who is impulsive, perfectionistic, hardworking, introverted, resistant to change and self-critical. They also tend to have low self-esteem based on body image distortion. Now, what is binge eating? Binge eating is a serious eating disorder in which you frequently consume unusually large amounts of food and feel unable to stop eating. People binge eating due to depression, genetics, anxiety, low self-esteem, and dieting.
Dieting is one of the most common forms of eating disorder. Patients that do not meet all of the clinical criteria for an eating disorder can be at serious risk and should seek medical treatment.
There are a few treatments that can help to overcome eating disorder. Enhanced cognitive behavioral therapy is specifically created for eating disorder and help in change thinking about food, eating, and patient weight. Next, interpersonal therapy helps people understand eating behavior. And finally, some people with eating disorders can get benefit from medication too.